Over the next couple of months, TCI Hospitals will be launching various initiatives in the hope of increasing medication education. This includes an education booth down in one of the local grocery stores, as well as we're hoping to meet with representatives of the local pharmacies in order to see how we can collectively work together to improve medication education on the whole island. Many patients are not as knowledgeable as they could be on their medication, whilst we at the hospital here will give them information when we administer medication on the ward, or the doctors will if they give the prescription in outpatients. The retention of that information generally is not very good. So we try to encourage patients to take control of their own medication and their own health care by understanding what each medication does, the dose, the side effects, potential side effects, any potential drug interactions which they may have, especially if they then go and purchase some other medications over the counter from the local pharmacy. Every medication that's administered on the ward or in an outpatient clinic or an ED, the patient will be informed beforehand of what the medication is, what it does, and then any potential side effects to look for, so that they can inform the relevant nurse if they start to feel any bad effects from the medication. The same would be true from the local pharmacies when they get a prescription. The pharmacist in the community will then explain the medication to them, what it's for, what side effects to look out for, what dose to take, how often to take, when to take it, with or without food, etc. for example. Also they will give them a information leaflet to go with the medication, so that if any information they forget, they can then read when they get home at their own leisure. For example, this is a medication that we would typically use in the hospital, and when the patients get sent home, they will then go to the pharmacy with a prescription and be given a box of these tablets to take on a daily basis. Now, within this box will come a patient information leaflet containing all the information that the pharmacist would have given you that you may have forgotten by the time you get home. Now, most people unfortunately throw this away. This is very important not to do that, and to keep this and to read the information contained, because it will give you information on the type of side effects to look out for, any possible interactions with any other medications, so that you have some information with you before you go to the pharmacy. What you might have on occasion is if the patient doesn't have a full history of their medication, or are fully aware exactly all their medication they're taking, when they go to buy something from a pharmacy, the pharmacist will then ask them, are you taking any other medication? If you're unaware or unsure of what you're taking, the pharmacist can't make a decision on which is the best medication for you to buy over the counter based on what you're already taking prescribed by the doctor. So therefore it's important to either have a list of all your medication, or one other way of doing it is to go to the same pharmacy each time you get your prescription. So they will then have a history of your medication, and they can check for you what medication you're on, and then decide which is the best over-the-counter product to buy that will ensure there is no drug interactions.